50 dental practices that I was responsible for in the Bedfordshire area in the United Kingdom, with a budget of over £5 million. In fact, it was close to £15 million. So my passion is in training, and I've been involved in dental nurse training for a while. So thank you again to OHPAG for inviting us on, and I hope we have a very interesting session. This is the second of the series, Putting Patients First, and I'd like here to acknowledge a few people. I'd like to acknowledge Dr. Bim Iyala from Premier Clinic Enterprises in Bedford, and I'd also like to acknowledge Dr. Sesh Rao, Tara Riley, and guided for us. So welcome to Risk Management and Infection Control. We'll run through this and take questions at the end. So, right, let me just drop this so that we can see what we're doing. Tonight, we're going to look at trying to explore and understand the meaning of risk. We're going to look and say, well, if we think this is risky, how do we enable risk identification and how do we identify risk? And then we're going to have to look at knowing what to do when things go wrong. The second part of our session, we're going to look at understanding the different aspects and areas of infection control. We're going to run through decontamination practice, and then we're going to look at COVID-19, Corona, and where we are now. So, when I was first asked to do this topic, even though it's a topic I've done before, I was, it's just such a huge topic to cover in an hour. I was sitting down wondering, how am I going to present this? And then a statement that somebody made to me came to mind. And that statement was, it was not raining when Noah built the ark. And I think we need to take 10 seconds and pause and just reflect on that statement. It was not raining when Noah built the ark. And to me, that statement just covers the whole attitude that we should have to risk management and infection control. We don't have to wait until the trouble meets us before we take into consideration what we have to do. So, let's look at the definition of risk management. If we go online and we dig around, it's going to tell us that risk management is a process. And it's a process for proactively, reactively identifying potential incidents, accidents, or near misses that could cause harm or injury to patients, personnel, and the public. It's also about preventing events and incidents and minimizing the damages that follow an event. So it's about proactively, which means looking at the risks that can occur before they happen. So we have to actually go seeking and looking and identifying risk. And then reacting.
Kindly unmute your own. Kindly unmute. Madam Zanato, kindly unmute your microphone. Madam Zaneto, kindly unmute your microphone. Okay, good. We can't hear you.
Done. Thank you very much. Yeah. Okay. So, so I was saying that it's about reactively and proactively looking at risk and and how we're going to minimize the damages. So we're talking about incidents, and incidents happen when we have risk that's not managed. So what is an incident? An incident is anything that leads to unintended injury or harm to a patient, a member of staff, or the public. And the key word here is unintended injury. So an accident is an unintended injury. But if it leads to a complaint, if it leads to loss or damage to persons or items in the surgery, if it includes incidents that nearly happened but didn't, then we have to pay particular attention to it. Okay, so examples we'll give here would be the wrong dose of medication prescribed. So the wrong dose of medication prescribed means that the patient hasn't actually taken the medication yet, but there is risk involved because it's the wrong dose. If the medication has been administered to a patient, or the wrong tooth taken out, or a member of staff injured in the course of their duty, so you slip and you fall, or the usual needle stick injury, electric shock, those are things which can be proactively identified, and we make sure that we put in place systems, protocol, and procedures to make sure that they don't happen at all. Now, if anything should happen, all incidents and accidents should be recorded in an incident and accident book. And the reason why we have these recorded is so that in reactively dealing with the risk or dealing with the injury or the harm that has been caused to a person, we have recorded the incident, we acknowledge that there was a risk there, and we can then look to see how we can make sure it doesn't happen again. So all incidents and accidents should be recorded in an incident book or an accident book. They should be reported to the appropriate responsible officer or the health and safety department, or indeed to your professional regulatory body. Because if you have an accident in the office or in the surgery, needle stick, for example, or you're working with somebody, or you have a patient that's come in with probably Hep B, Hep C, or something that has infected you, you need to let your professional regulatory body know, because you need to know how you're going to react to the public, with patients, and with your colleagues. So these sorts of things shouldn't be hidden. They should be brought out, and you should have the support that you need to deal with them. So all incidents need to be reviewed, they need to be reacted to, they need to be actioned, they need to be resolved, and the learning from the incident and the accident needs to be shared. So we need to assess the situation, we need to look at how it happened, we need to look at the risk involved, and yes, we need to look at how often is it likely to happen. If it's something that's likely to happen a lot of times, then hey, it is high risk. If it's not going to happen too many times, it's low risk, but it is still risk. And that's what we need to acknowledge, okay? And we need to take steps to eliminate them. We need to realize that all risks are liabilities. So even after we have implemented procedures and protocols to prevent the risk from happening again, we need to monitor and make sure that, yes, indeed, they're not going to happen again. So what are the expectations of the dental team? What are the expectations for the dental team? And what are the expectations we have of other people? So the main key players that we have with regards to risk are our employers. And when we have the expectations we have from our employers is that they will make sure that all risk is identified before we even start the job. So before a DSA walks into the surgery, the employer should have gone through the practice to make sure that there's nothing in the practice that is going to cause harm to any of the employees. And that is statutory, legal, and mandatory. The employer has a duty of care. Now, the DSAs and the dental team have a duty of care towards themselves. So you're responsible for identifying and making sure that no risk comes to your colleagues in the workplace. And indeed, no risk comes to yourself. So if you do spot something, you're supposed to highlight it. And you're supposed to have the training to know what is risk and what is not risky, and be able to resolve the issue or report it. Now, the other thing that needs to be done is there are areas that we work in clinically that, whether we like it, they're part and parcel of the job. So for example, X-ray situations. So X-ray, we need to make sure that wherever we have X-ray equipment, the signpost is there to say, hey, anybody coming into this premises, this is a risky area. We've identified the area. It is there, it is clear, everybody can see it, and so therefore they can prevent themselves from coming to harm. Patients and public are our responsibility, but at the same time, you can discuss this. So let's take the first clip. Please send me a message if you can't get the volume.
I think the volume is not coming on.
The volume is not coming?
Yes, please.
Okay.
Things for the day in the sink, and then it goes straight. All of this you can see is.
Have you got it now?
Yeah.
So this is one of our surgeries.
Okay.
So we have two sinks. This is the clean sink. This is the dirty sink. All of this you can see it's labelled, so it's zoned into the clean area, and then up to this mark here, and then beyond here is the dirty area. So this is where we keep our dirty instrument box and our sharps. We can put debris and things from the day in the sink, and then it goes straight into the bin, the clinical hazard waste bin. You don't need to do that with your hand, anything like that. At the end of the day, all of our instruments go through a sterilisation process. Once that's happened, they then get put into sealed cases, and they can get stored in the cupboard. Sometimes, to make life a little bit easier, we set up our trays for the following day. These instruments, again, have gone through a sterilisation process. They've gone onto the tray. They're then put into sealed bags, and they can be then stored in the cupboard for up to 24 hours. Our pouched instruments, you can see they're all stamped with a date. These can only be stored in the cupboard for a year before they then have to go back through the re-sterilisation process. But this has got a stamp, so it tells us when that time is ready. When we're in surgery, we obviously have to wear full PPE. At the moment, due to COVID-19, we're wearing full surgical gowns, a face mask. We've got a few different varieties. We wear a full face visor, and we've got the gloves available to us at any one time. We have sprays that we use on every single surface. We also have clinical wipes, and that's just to antibacterial all the surfaces, the chair, all the light fittings, everything like that. Having to be extra careful with things at the moment. Everything that you're wearing in surgery, so if you've got your PPE on, if you've got your gown, your gloves, must come off in surgery. You don't walk out of the surgery wearing dirty PPE.
Okay, that's the end of the first video. I'm going to take you through the second one now.
So this is our decontamination room, and when we're in the decon room, we have to wear gloves, mask, full face visor, and an apron. It's separated into two areas. So over this side, we've got the dirty area. This is our dirty box that has come from surgery. This is our ultrasonic. So the first thing we do, because we're dealing with dirty, sharp instruments, we put on the thick gloves. This is the dirty sink. So we have our instruments here. and you manually brush the instruments under the water so the liquid doesn't spray up at your face. And that goes in the ultrasonic machine. And you do this for all of the instruments. And you turn this on.
I hope you are all
For its cycle.
taking notes and making sure.
When the instruments come out of there, we've got this light, and you hold the instruments underneath the light so that you can see if there's anything which is still on the instruments. At that point you can clean it again yourself. Once the instruments come out of here, they go onto one of these trays with a test strip, and they go into the autoclave, and this is where the final sterilisation process happens. From this area is clean. So at this point we would take off all of our PPE. Move over here and you can wash your hands at the
I want
feeder
us to
sink.
make this particular note here that there are two sinks. One is a dirty sink and the other one is a clean.
When the instruments come out of the autoclave, obviously they're clean, they can go into the clean boxes and then they can be transported to surgery. We also have these pouches. So some of the instruments will go into the pouches in the autoclave, or once they've come out of the ultrasonic, out of the autoclave, they'll then go into the pouches. This is then stamped. They have a 1 year that they're allowed to stay in the pouches for, and then they can be transported through surgery, or they can be kept in the cupboard for up to a year safely.
Right. I'll take 2 seconds here before coming on to the third video to just reiterate some points that came up in the first video, which I hope you noticed. And in fact, with respect to infection control and risk management. Now, you'd notice, and it's not possible to have all these things in all the surgeries. So this is just showing what happens in one particular surgery. But it's good for us to have good habits. And one of the best habits you can have is remembering that you have feet. Some of our drawers can be actually opened with our feet. So we don't have to be touching things, especially now with COVID. You want to minimize the amount of times you actually are touching things. And then wiping the surfaces down. So in the first video, she mentioned about wiping the surfaces down, wiping the chairs down. Okay, I'll move on to the third video, and then hopefully some questions will come up at the end regarding the videos.
Heat the water up to less than 45 degrees Celsius. Put the correct amount of chemicals into the container according to the manufacturer's guidelines. Now fill up the container with the correct ratio of water. Remove the gloves and put them in the clinical bin.
Using the feet and using...
The outside of the dirty box should be clean at all times. Open the box with clean bare hands. Apply a new pair of gloves. When manual cleaning, heavy-duty gloves must be worn to prevent sharp injuries.
And you'd notice here that they use two...
First, clean the tray. Ensure to do this in a downwards position.
It is recommended to clean the trays in a downward position.
Only take one instrument at a time.
So that
Fully submerge it under the solution.
So that you're not scrubbing, because when you scrub, you create aerosol.
This prevents aerosol.
Exactly.
Ensure to scrub in a downwards motion. Remove your heavy-duty gloves. Do not submerge handpieces under the solution. These need to be oiled prior to sterilisation and after. A clean tissue needs to cover the end of the handpiece. This is to prevent aerosol contamination and to ensure that the oil comes out clear. Ensure the handpiece is stood up on a tissue to let it drain. Now remove your gloves. Now replace your gloves with another pair. Ensure your instruments aren't touching each other. Now they need rinsing under RO water, otherwise known as reverse osmosis water. Remember the handpiece should not be submerged underwater. Now change your gloves. All instruments need to be seen under a microscope to ensure they have no debris left on them. The tray needs to be inserted into the autoclave. Remove one glove. Now you can close the autoclave door.
With clean hands.
And turn it on. With clean, ungloved hands, open the autoclave. With a clean tray lever, remove the tray from the autoclave. Carefully take the hot tray to the clean zone.
So the zones are dirty zone and
Now
clean
with
zone.
clean gloves, pouch the instruments in a pouch dated today's date and a year today. Ensure to seal the pouch using the dotted line provided.
Brilliant. So I hope you have taken down a few notes with regards to specifically today's topic of risk management and infection control. I'm going to run through now the rest of it, and then we take questions at the end. I have another 2 or 3, I think, that will come up later.
So this is one of our surgeries. So this is our...
Right. If we were doing a live face-to-face, I'd stop here and give us like 5 or 10 minutes to discuss. But in view of the fact that you're going to be able to discuss these later, and I would really want you to, in your surgeries later on, or in your groups, or indeed in your meetings, so in the OHPAG meetings, the regional meetings, you could pick up some of these slides and discuss them, or indeed the videos, and discuss them in more detail. So what I have done here including hazardous waste disposal. So looking at your waste disposal, what do you have in place for Legionella control? What do you do with water line flushing? Okay. When you look at instruments and equipment, are they stored appropriately? Okay. Do you use them appropriately? So do you use a curing lamp with a shield, or do you just use the lamp and think, oh, it doesn't matter? Some of these things, they don't affect you immediately, but they affect you later on in life. All right. You need to remember that your job is your job, okay? And you don't want to come to any harm that's going to impact on your domestic life or indeed your old age, okay? So we need to minimize any risk. There's also risks to materials and risk to personnel. So with personnel, are you qualified to carry out the role that you are given? Are you fit to practice? Is your certification up to date? Is your registration up to date? Is your inoculation up to date? Have you taken all the vaccinations that you're supposed to take as a clinical personnel, as a healthcare personnel, that allow you to safely work with patients and public? This is risk to yourself and risk to your family, especially with Corona. You can take something from outside and bring it home, all right? We need to look at health and safety. We need to look at COSH, we need to look at radar, we need to look at radiography incidents, and you need to be supported by your professional or regulatory body. So registration is important, okay? And there's reasons why we put emphasis on registration and making sure that you are fit to practice, that your environment is fit for surgery and for patients to attend. I've given you here some scenarios. So you will have to determine whether they're high risk, low risk, or no risk. So if consumables are kept on a high shelf, is that going to be high risk or low risk? It depends on how often you need to access those consumables, okay? If you're leaving a patient alone in the chair with a carer, is that high risk, low risk, or no risk? You've left somebody alone in the chair in the surgery, okay? If you're washing instruments under running water and reusing them, especially if they're single-use items, is that high risk, low risk, or no risk? So for every single thing, every single procedure that you do in practice as a professional, you need to be assessing the risk to yourself and to others. I'm not going to run through these because these are just for information, but they're mandatory risk assessment areas that you need to be aware of. The other thing I've provided you with here is the diagrams of COSH assessment. So all these symbols appear on instruments, equipment, materials that we use, and substances that we use in surgery. Whenever you pick a packet or a tube or a bottle of anything, look at it, know what's inside, know whether it's risky or not.
Zanetta, please, sorry for interrupting. There is something that is popping on top of your screen. It has blocked the heading. Can you let it go back? Yes.
Right, okay. It's probably better at the bottom.
Yes.
Okay, all right.
Okay, good night. Bye-bye,
All right.
tomorrow.
So the other thing I've done is giving you some instances that you need to look at with regards to fire safety risk assessment. And then I provided you with a list of your fire extinguishers, the different types of fire extinguishers. And all this information now, we're so lucky, all this information is available online. So you can actually go online and have a look at fire extinguishers, know what's in them, and know how to use them. To be honest, every single practice, whether it's public sector, private sector, or community, or maybe something that a professional regulatory body might be able to help more with. But it's providing participants, providing our membership with training once a year on fire hazards, knowing your different extinguishers, knowing how to use them, and looking at other risk areas and how best people can prevent injury. So my favorite textbook, I'm not going to, yesterday I read out of the textbook, I'm not going to read through that today, but if you want to have further reading on the subject that we're covering today, then obviously Levison's has got it in chapter 4, pages 74 to 122. So again, I had this slide yesterday, and this is just saying that we all, apart from we all deserve respect, we all need to look at our lives. We have a cycle of life that we all start and we all end, and we need to make sure that we come to no harm or as little harm as possible, because old age and all the different stages of life come in with their own issues. Okay, so just like yesterday, anyone who walks into the surgery is somebody. We need to make sure that we care for all our patients, irrespective of whether they are the cocoa farmer, whether the person comes in his medical attire, and whether or not we know that person is actually a chief or somebody of importance, of status in our community. It doesn't matter who comes into the surgery. We need to know that when they walk into that surgery, they're coming to no harm. They're going to be treated with respect. They're going to be treated with all the dignity that they deserve as a person, first and foremost, and then as our patient. Again, I put up this slide. We touched on this yesterday, but it comes under risk management and infection control because we have a duty of candor. And candor comes from the word candid. We need to be very candid about our actions, about our words, and about our treatments that we provide to patients in our surgeries. Openness and honesty when things go wrong is paramount. There is a long list of instances that you can dig up online that tells us about when things have happened to patients and public in dental treatment. Now, we need to minimize these as much as possible because when these things happen, they jeopardize your profession, they jeopardize the profession of dentistry, cause harm to persons. So when things go wrong, we need to immediately inform the patient's family, inform their carers, inform the patient, make a record of the incident or the accident or what nearly happened, okay? If even it nearly happened but didn't happen, make a note of it because later on you can go back and adjust it. Now, we need to give a full explanation of what has gone wrong because we're legally bound to doing this, all right? So we need to give a full explanation of what has gone wrong. It needs to be written in the patient's notes. It needs to be written off the patient's notes, away from the patient's notes as well. So if you have a practice diary, the incident needs to go in there. It needs to be anonymized and it needs to be recorded because if any reaction comes back from the patient, we need to be able to go back and pick up those contemporaneous notes, okay? The patient needs to be aware of both the short and the long-term effects of what has gone wrong and what to expect. We need to put matters right if possible. We need to be able to put matters right, right? It may not be you, but we are all clinicians, so you need to be able to help those that you work with to be able to put matters right. As a team, the practice needs to offer both a verbal and a written apology. As a dental nurse in the UK or dental surgery assistant, I am required to have indemnity insurance myself. So irrespective of the dentist having his indemnity insurance, irrespective of the corporation or the practice having insurance, as a DSA, as a dental nurse myself, I am required to have indemnity insurance. So if, for example, I'm using acid etch or something, and it goes on the patient, and the patient gets a burn, and the patient makes a complaint, and the patient sues the practice, my insurance is what is going to make amends and put right what has gone wrong, okay? So a member of staff needs to be assigned to the patient, and this member of staff needs to work with the patient and their family to make sure that it goes right. And we need to inform the health and safety regulator or professional body if something happens that's going to have an impact on our professional
Queen.
on our right to work. And we also need to provide appropriate support for members of staff in case of injury. So the appropriate support will come from either allied health professionals or maybe from OHPAG, but there needs to be some sort of support and some place that staff will be able to go to if they do come into contact with any incident or hazard, that they can report anonymously, that they can report things to do with themselves, and that they can get the support, the advice, and the guidance in order to continue with their professional career. Okay, so let's come back, let's move forward onto infection control and cleanliness. I like the way it's termed infection control and cleanliness, and this is found in chapter 8 of the textbook, all right? Now, we all know that cleanliness is next to godliness. So whatever we do in our private life, whatever we do in our professional life, we need to remember that we need to do what is right at all times. This is going to take us nicely into the next set of videos. And this video has been provided by Dr. Sesh Rao and team at Shepherd and Stotfold Dental. So again, I would ask you to please make notes, take notes of the practices that are going on, and we can discuss these at the end. I'm going to run through it so we have time for discussion at the end.
The protocol for doffing. First, remove your gloves.
Stop this here. Sorry,
Do not touch the outside of the gloves
before we do doffing. So I'm going to start from donning, then we'll move into accepting and receiving patients, then we'll come to doffing.
Ensure to wash and sanitize your hands prior to donning. You'll need a buddy for donning. Apply shoe covers. This helps with protection. Sanitize your hands to ensure they are clean. Have your buddy help you put on your sterile gown. They'll need to help do it up for you.
The sterile gown is used when they're going to treat patients where the procedure is going to be aerosol generating. So they don't use the gowns for all clinical procedures. It's just where they know that there's going to be aerosol.
Put a head cover on.
And this has come into place primarily because of Corona and COVID.
An apron needs to go on top of the surgical gown.
We would only use these if we're doing things like implants or oral surgery.
Use your FFP3 mask. Place it over your face and let your buddy help put it on for you.
I still lower the thing. I've even forgotten how to.
Make sure it is tight and in place. Apply goggles for eye protection. Your buddy will help you put on your gloves.
She's not actually putting the gloves on herself. Okay.
Ensure they go over the top of the surgical gown.
That she's used on her hand, she's kept her fist tight until the buddy came to help her put.
Once the gloves are on, do not touch anything. You'll need a visor for extra protection.
Over the mask and together with the goggles. So that's the first one. So now she's in full kit, ready to go and receive, ready to go into surgery to receive patients. And this is, like I said, for aerosol generating procedures. I'll go now and quickly take you through receiving patients. These procedures, I will emphasize, have come into place since Corona joined us.
Once you've called the patient to let them into the practice, you'll have to open the door for them and get them to stand on the designated area.
The patient doesn't even
now you have to take their temperature. If it exceeds 37.8, you'll have to send them home. You'll have to ask them if they've had a cough or shortness of breath.
I want you to take particular note of the way the items were placed on the desk before the patient.
Now you'll have to give them hand sanitizer before they go any further into the practice.
You will note that
now ask them to put on a mask.
The side of the board is what is up and the paper side is down.
Now you'll need to ask the patient to sit down on a wipeable chair. Now give the patient some hand sanitizer when the dentist is ready for them to come in. Now you can escort them to the surgery. You may need an extra door for them to go
They
out
come
of.
in one door and they go out a different door. But that's not possible in all surgeries.
Now ask the patient to stand on the social distancing dot in the surgery.
Okay. So the patient is standing on the social distancing dots in the surgery. Now this is because they've measured where the farthest point is for the patient to be able to stand and talk to the dentist or the nurse before they actually sit in the chair. Okay. So I'm going to go now into doffing.
The protocol for doffing. First, remove your gloves. Do not touch the outside of the gloves. Sanitize your hands. Remove your outer apron. Do not touch the outside of the apron. Do it from the inside. Remove your gown from the top. Roll it down your front. Do not touch the outside. Now undo the back. And roll it inside out.
Okay.
Please note that these gowns are sterile and disposable.
Remove your visor. Do not touch the outside. Remove the goggles. Do not touch the outside. And lastly, remove your foot covers. Sanitize your hands to make sure they're clean. You will have to take your FFP3 mask off in a different room. Remove the mask carefully. Ensure to remove the head cover from the inside. Now wash your hands thoroughly.
Note that irrespective of the amount of sanitizer that she has used, she's washing her hands. And I know for a fact that they wash their hands so many times, okay? And it's a habit that we all need to get used to. All right, so I want to again acknowledge with thanks the practices that provided us with these videos, because I literally just phoned them and say, hey, can you let us share with you what you have procedures you have put in place?
Once you've called the patient to let them into the practice, you have to open the door first and get them in.
Move swiftly on. So the expectations, our expectations, it is a legal responsibility of our employers to make sure that we are trained, we're appropriately kitted out, and we have the appropriate PPEs in place with regards to infection control and risk management. With our colleagues, it is our ethical, professional, moral, and social responsibility to make sure that we acknowledge the infection control practices that have been put in place and that we practice them till they become second nature. With our patients, there's a social, ethical, and moral obligation there. Our patients need to be able to tell us when things are not quite right. We need to be able to tease out from our patients what their habits are, their personal habits, their clinical needs, their social habits, in order for us to know whether there's risk of infection for us to take the necessary precautions. So it is our responsibility to make sure that everything goes on all right. So again, who gets infected and how do they get infected? Patients get infected through instruments and equipment that have not been properly washed, disinfected, sterilized, and monitored. And note that even when they're washed, disinfected, and sterilized, they need to be bagged and they need to be stored, and the bags need to be stamped with the date that the sterilization process took place. If they are frequently used, they are stored in a cupboard for not more than 24 hours. Otherwise, they're stored in a place where they're not going to be accessed, and they can be there for up to a year if they're not accessed, okay? Patients can get infected through infected personnel. So we can infect our patients the same way our patients can infect us, okay? We can infect our team, we can infect our colleagues, all right? So we can infect them through infected instruments and equipment. So we need to make sure that we follow procedures to the nth degree. Whatever we've been taught, whatever we've learned, we need to make sure we put it in practice, and we insist that within our teams, we all come to the conclusion that we need to put things in practice. I just want to go back to the wider public. So the wider public, again, like I was saying earlier, you know, you take these things to your families, and you can be infected through patients. So other patients coming to surgery bring things that we pass on to other people, and they can be infected. The wider public, especially with corona, can be infected through us as clinical personnel. Okay, so why do we need to monitor these? Like I said before, it's because people coming with bacteria, they come in with viruses, and they come in with fungus infections, okay? So we need to wipe down, we need to sterilize, we need to disinfect. The fourth thing, which doesn't usually come up in conversation, but which I'm acutely aware of, especially with these days, and is patients' mismanagement and misuse of antibiotics. And in some spheres, I know with clinical personnel, there's an agenda that we need to learn how to not prescribe antibiotics, because the more people get infected, the more antibiotics they take, the more they become antibiotic resistant. And therefore, you find that diseases are spreading, infections are spreading, because our patients and the public are antibiotic resistant. Okay, so we need to be wary about that. So, how do we manage the system? And we manage the system, clinical environment, through infection control and decontamination. And what is the process? The process for infection control and decontamination is through cleaning. So cleaning in dental practice, we have what's known as social cleaning. Okay, that's the first barrier. The first barrier is to clean. So you clean the floors. You put a little bleach in warm water with a mop every evening. We clean the floors. We wipe down the surfaces. We probably have a cleaner that does the public area, and the dental nurse, dental surgery assistant is responsible for the clinical area. If you're lucky enough to have that, that's very good. Okay, if you don't have a cleaner, then it means that you're responsible for making sure that the reception area is wiped down, the floors are mopped, the toilet area is clean, the toilet is disinfected, there's bleach in the toilets overnight, because when you put bleach or any disinfectant, appropriate disinfectant on surfaces and leave it overnight, it gives the fluid time to work on the surfaces, okay? So that is social cleaning. That's just making sure that there is no dust and the area is clean. Now, when it comes into the clinical area, we've got our wipes that we need to use. You need to use the appropriate wipe for the appropriate surface, okay? So use the appropriate wipe, tabletops. We make sure that our computers and keyboards, we use cling film to cover them so that dust doesn't go into them, and we can type on that, and the cling film can be changed every day. We make sure that on top of our lights, so on top of the lights has been cleaned and is wiped down. The handles where we touch and we hold to adjust the light for the dentist and adjust the light for the patient, we make sure that that is cleaned. And now with COVID and aerosols, we need to make sure that the surface of the lights as well is clean. You need to make sure that around the spittoon has been wiped. You need to make sure that where the 3-in-1 tips and everything goes in, we need to make sure that all that is clean, that the tubing is clean. We need to make sure that our instruments are sterilized. They need to be washed. They need to be rinsed. They need to go in the trays. They need to go in the autoclave. And then the other thing that's supposed to happen with instruments is in all surgeries, and this one I can say without a doubt, every single surgery internationally, the best practice is to have a magnifying glass in the surgery, and you put the instruments under the magnifying glass when you come out at random to make sure that there's no debris left on them. And for those of us who were practice managers, I can tell you without a fail, I used to go around all the drawers. I pull the drawers out. I have a handheld magnifying glass and I scan the instrument. And if I see any white fleck from anything on any of those instruments, I'm picking it out with a tweezer and putting it on the worktop so that the following morning when the nurses come into the practice, they take all those instruments, they clean them all over again, and then they put them back in. We need to disinfect. And disinfecting, mostly it's, oops-a-daisy. Let me go back to that one. So disinfecting specifically with a chair. At the end of the day, part of the closing down procedure is to run disinfectant through the tube. So you take all your tips out, you take the suction and you put it inside the container. The disinfectant runs through that. It disinfects the whole system so there's no backflow, or if indeed there's any backflow, it's been disinfected for start of work the next day. PPEs and inoculation, I can't stress how important these are, especially in this day and age. So the whole process of cleaning, sterilizing, disinfecting, using our appropriate PPE, known as infection control and decontamination. Washing of hands, washing. I mean, now a tractor driver knows he should wash his hand. The coconut seller, when I go to buy my coconut, I say, Charlie, how? Where's your bucket for me to, your Veronica, this thing for me to wash our hands? Everybody knows now that we have to wash our hands. Every single hour, you must wash your hands at least twice every single hour to make sure that we're not carrying things in and not bringing things out. Okay. So now we're going to go into, quickly go into what I call the Corona update, okay? So we've all heard the news and what's been on the news, all right? Joy FM came out and all the newspapers have come out to say that, 150 medical doctors and more, because the count is going up every day, okay? So many of our frontliners, so many people have come down and tested positive for Corona. We need to make sure that we keep ourselves safe, okay? So social distancing. The slide, on the right side of the slide, there's a depiction there of the best distance and how you should, the probability of catching things. And there was a story on the newspaper, I think it was on the newspaper, on the radio I heard yesterday, about a nurse who tested positive, and she was sitting in Trotro to go to her for her clinical appointment. Okay, she knows she's positive, but at the end of the day, it's means. If you don't have the means to take Uber, you don't have the means to take dropping, you have to take Trotro. Please, for heaven's sake, Remember the rest of the population. Make sure that you have a mask on. Make sure that you've washed your hands. Make sure that you sanitize, okay, and keep the distance. The best distance to keep is to stay at home. If you don't have to go anywhere, don't go out. Now, with regards to in-surgery and what you need to do with regards to PPEs for different procedures. On the left-hand side of my screen, there's a chart, and that chart shows you what you need to wear if you have aerosol generating procedures coming on. Okay, I'm trying to see where my cursor is. Okay, so AGE is whether there's a high risk of aerosol generation. Now, the aspirational is that you will wear a mask, a visor, a gown, hat, and shoe covers. But where these are not provided, you need to make sure that you have the appropriate mask, you need to have a visor, and you need to have some sort of gown over your normal scrubs. Please, over your normal scrubs. If it is possible to have a seamstress sew something for you that you know that this is what you're wearing over your scrubs before you go home, it is in your interest to make sure that you take appropriate safety precautions for yourself. All right, so that's on the left side of the screen. And then the conditional things are there and what you need to do if it's a low risk procedure. On the right-hand side, there's a nice cartoon there that shows you all the different things from head to toe of what needs to go on. All right. Some of these things, we've not been provided with them locally, but it's good that we know, because if you know, you can ask your dentist and whoever is responsible and say, hey, you know, we want to do our job properly, but, you know, is it possible that we can follow these procedures? And I'll admit I'm on the dentists and healthcare, medical and dental WhatsApp group for the UK and in Ghana. And so some of these things I'm sharing with you, the dentists already know that these things should be provided. So if it's not provided in your surgery and you have a practice meeting, you know, and it comes up in conversation, you should feel free, okay, to highlight these things. So I'm not going to go through everything in detail, but you can take your time later to go through and find out what is needed. So this is a protocol which has been put in place in, I think it's Dr. Rao's surgery. All right, so they've updated things like the medical questionnaire. They've updated it to include questions to tease out whether patients have come into contact with any COVID or corona infection. There's a list of what to do in the waiting room. So avoid using the waiting room if possible, which means don't get too many people in the waiting room if you haven't got enough space for them to. I know in one of these surgeries, what they do is because the patients are booked on appointment, they make the patients come at their appointment. It's only the one that has the appointment that comes into the surgery and goes through the side patient in. Okay, there's things like air misting. I know locally it's on the market, some sprays that you can use to just spray the air and disinfect the area. In this particular area, I would say no air conditioner use. We're in Ghana. I know the place
with our health. We cannot for any reason. Those who give us the 9 pieces of or 9 pairs of glass, whatever we intend calling, will not want to use the same, will not want to use 1 pair of glass for 1 week. No, they will not want to do that. They know the implications of it. And they know that it is just us or you over there that they can put you at that risk. It's nothing to them. Because when you are out of the scene, they may easily hire some people and then get them through the same thing. I believe that it is time for positive defiance, especially when it is something that will help all of us. please let's take note of that. I have had occasions to address issues of this sort where people come and they are asking, these are the logistics that they are providing onto us, especially at the time of COVID. And they're asking whether or not they go by what the institution is saying. And I'm like, look, Vice already said the labor law is very clear. If you feel that you are not secured at your work site, they use the term remove yourself.
Yes.
Remove yourself.
Thank you.
There is nothing, you just take yourself out of it. And that is what happened. Immediately at my work site, the moment COVID came and, we were waiting for management to take decisions, I mobilized my people at the work site. I'm not the head there, but I thought it is necessary to really talk about it. And I told the person, yes, this time it's no longer safe, number one, to do peeling and polishing. I'm not going to do it, and I'm not going to assist anyone to do it.
Thank you.
Just shortly, we saw the chief dental officer issued, I think, a communique, regarding that and some of the services that can potentially put us at risk. Last week, chief dental officer called and I asked, the letter you sent, yes, we've seen it. Have you given any contrary, letter, something, at least another letter that indicates that we can now resume some of the things? Well, I just wanted to know out of curiosity. He said, no. There is something like that. Whatever protocols that we all agreed on in the past is still what we are going by. So please, my brothers and sisters, if you are in an institution where they are not thinking about your safety, take your own personal safety into your hands and take good care of yourself.
I cannot emphasize that enough. And I'm only using the example of the UK because obviously that's the area that I know, and I'm conscious that the Ghana Doctors and Dentists Association UK, they follow best practice, and they are pushing and pushing and pushing for best practice to be followed in Ghana. So when I talk about the UK, I'm not talking about my colleagues, who have kindly provided us with the videos. And in fact, one of those surgeries, the lady who owns the surgery is Nigerian. So we're talking about an African surgery here, okay, more or less. But I'm also talking about what Ghana Doctors and Dentists Association UK is working with and wants to make sure it's instituted here. And indeed, they've done presentations of PPEs and stuff, to organizations and institutions here. So we're not talking about something that they are not aware of. But in the UK, as soon as COVID came down, every single dental practice was closed. Okay? There was only emergency provision for non-aerosol generating procedures in specific emergency clinics where the staff were trained in what to do. And this was like, they've been closed, everybody go home, until procedure came out and protocol came out. And even when the protocol and procedures came out, it was suggestions. And the practices have been told that if you don't feel you are up to it yet for your staff to go back to work, don't go back to work until you are sure that your staff, because outside, like I said before, I have to have my own insurance indemnity as a dental nurse, dental surgery assistant. Now, if my employer opens up the surgery and somebody.
Sorry for cutting you, cutting into it. Sorry. Let's pick some few questions. Probably some of them will come and you use your example to illustrate them.
Yes. So I just feel it's necessary to
you will still chip it on this. You will still chip it in. Very, very important because we need those experiences. But let's take some few questions. Yes, Madam Miriam, yours first. Please keep it brief. One question brief.
All right.
A lot more can ask.
Oh, okay.
When the time is up. Very brief.
Okay. Good evening. Thanks for a lot for this explanation. Especially goes to my president with this Labor Law Act and all that. I wasn't aware of it. But then when this thing started, a reputable institution like mine they were like the PPs that they are giving, especially the disposable one. They give you one and then you wear it for the 5 days. And I was like, no. But then my own colleagues are like, why are you doing like that? Management said this. So clinic administrator has to call me. And it's like, one costs like 50 cedis. And then when they realize that we have to change it like that, and then at the end of the day, the money that they are getting is more than what they are spending or what they are using to buy as the PPs, then they have to close it. And I said, fine. If they close, if that is the thing that will help them, fine. But me, I can't wear my PP, the paper one, for the whole week. I don't know how. They didn't tell me that. Even with, apart from that, if that is what they are doing, then I'm ever ready to disclose this to any media that will come across. Then it's like they are talking, and right now I'm talking about media. And I said, yes, if they are not doing the right thing, because I said I'm not doing it. My other colleagues were like, me, I'm doing something. You see, when something comes up and you are telling them your mind, then the other colleagues are like, you, everything, you take it personal. And what is this? And in Jesus' name, you not get corona.
Madam Miriam.
Did you get me? So my question is it in this time that we have to do improvise?
Beautiful.
Do we have to improvise in this?
Noted. Okay. So, Madam Zanata, please take note. George.
Yes.
Yes, Jojo Mane. Is George online? Your hand has been up.
Yes, okay. I'm online.
Please, we are listening. Yes, George. Ask your question.
Okay, I needed a clarification on the concern you raised in order not to be misled. Is it nine face masks or 9 pairs of gloves?
9 face masks.
Because it's not possible.
9 face masks. One for a week. Yes, and the surgical one.
That's actually a common thing going across all the facilities. But then when you said gloves, it was so odd.
Not gloves, it's face mask. Sorry. Thank you for the correction. Okay. All right. So let me take another iPhone lady here. Madam, iPhone. Unmute it before you talk. You are smiling. No, unmute it. Oh,
okay.
Good.
All right, that's okay. Hello, good evening.
Good evening.
This is Catherine again. My question goes to Madam. It's about PPEs. In my facility, we don't have the disposable ones, but I always go to the theater to get the reusable ones, and we use. But unfortunately, we don't have the shoe covers. Can we improvise the nurse's cap for the shoe covers? And the second one is the use of antibiotics. We, the health workers, I think we know that too excessive use of faith would harm the patient or would stop them. Let's say the day the person needs it more, it wouldn't work. So we wouldn't prescribe it more often, but the patient themselves go to the pharmacy and get their antibiotics till they can not handle it anymore. That is the time that they come to the hospital. So my second one is just adding up to what you've already said. The first one is, can we use a nurse's cap to cover our shoes as an improvised shoe cover? Thank you.
All right, so the last one will come and then you answer them. The last one. Robert Isuman, I'm sure you are the one using the Techno Spark 4. If you are the one, please go on. Okay, all right.
Okay, thank you very much. My question has to do with the decontamination and the sterilization. On the video that we saw about before we autoclave the instrument, Nurse director said something that we need to arrange the instrument in such that one will not touch the other. But my question is that looking at our setting here, that a day we can have like 10, 15 patients trooping into the services. We can't do this arrangement as we said. So how best can we, as assistants in the services, how best can we, with regards to the proper protocols when it comes to the decontamination and the sterilization of the instruments? Looking at our setting, I know that what she's saying is the one that you use at the UK and other things, but here in Ghana, looking at our setting, is it possible that we can also do the same? Thank you.
Okay. So thank you. So Madam Zanetta, you answer, and then I'll take Majid and then Jennifer Zifa. So please go ahead with
okay.
your.
Thank you very much for that. So I'm going back to the lady whose concern was about the raising the issues and not being acknowledged or supported by her colleagues. For that question, I would say you have OHPAG, okay? You have an organization that is supposed to be supporting the membership. In times like this and in circumstances like yours, it is not unique. Most professions have gone through the same issues till they get to, the standards are raised, the bar is raised, and the standards are raised, and everybody works in a better environment. What you need to do is to have a conversation with your professional regulators and your professional bodies. Come out with suggestions, not just complaints, but come out with a list of all the issues, come out with the suggestions for change, and then come out with, set demands. And your demands need to be realistic and implementable, okay? And they need to be evidence-based. So it's not just saying, oh, we want. It's we want because of X, and we have the support of Y, and there's a general consensus that this needs to happen because this is the end result if it doesn't happen. Okay, so you need a document and you need support. The document has to be concise, straight to the point, not politically, whatnot in any way, shape, or form, but specific to the profession, okay, and the changes that you need to see happen. Like I said before, our dentists are aware of the standards and the bars that we need to, the heights that we need to work towards. So it won't be anything strange. It's just that awareness needs to happen. Now, the second question was...
please wrap it up. I think we have about 5 minutes. I'm looking at the time.
5 minutes to go. Okay. So with regards to using your headgear for shoe covers, I would say it depends on what your headgear is, because if it's plastic disposable things like shower caps, normal shower cap, those plastic disposable, yes, you can get those. I mean, those are useful. Again, your employer is supposed to provide. Sometimes it is necessary for us to do what is right for ourselves, for our employer, for it to tweak, their conscience to say, hey, this girl, she's always doing this. Or, my team, when I come to work, they've gone out and they've bought their own this thing because they are conscious of what should be in place, okay? So sometimes, subliminal messages need to come across to employers, but protect yourself, because if you are ill, you're taking it to your families. And at this time in space, we can't afford that to happen. Okay, now the gentleman with the instruments, yes, that was a demo, and she put the instruments only 4 or 5 in a tray. But I can assure you, when you have 20 patients coming through the surgery, the instruments are going into the autoclave on a rolling basis, all right? We try as much as possible, and probably in some surgeries, you are provided with more than in other surgeries. So in some surgeries, you can afford to put the instruments so they are not exactly, they're full, but they're not exactly touching and they go in, and you have enough behind the scenes to work with. So those can be going through while you are taking the next lot out. But that's not the case in a lot of surgeries, and I'm aware of that, okay? So you need to work within the boundaries of what you are provided with, but you need to do things appropriately. You need to try and do things as best as you can and make sure that you follow procedures so that you don't cause injury or harm to yourself, and that is the main thing, okay? I hope I've answered those questions as best as possible.
Yes. So let Jennifer Jifa, please come in, unmute and talk. We are listening. Quick, 30 seconds.
Hello, good evening.
Good evening.
Good evening.
Please, I'm Jifa.
Okay.
I work in practice. My concern is that we see patients back to back and we do procedures like RCT from start to finish. And we don't get ample time to clean the place before the next patients come. What advice do you have for us?
Okay, so Majid, also take your question. Majid Nantoma, ask your question. Is Majid online?
Yes, please, I'm online.
Yes, please talk.
Yes. My question is, when it comes to sterilization of sterilizing the instruments and then arranging them, during the demonstration, there's a bag you put all sterilized instruments. In my settings where I work now, we don't have such. So what can we use as an improvised means in saving the instruments for next procedures?
Thank you, Majid. Yes, President Solomon, Eastern Region, kindly ask your question. Yes, we are listening, Solo. I did ask about improvisation.
Instruments, yes, that's it. Okay, I wrote instruments. I couldn't remember what aspect.
Yeah.
Okay, so improvisation, right? Olonka bags, okay, Olonka bags or cling film. All right, those bags, the pouches are sterile pouches. Yes, okay, they are purpose made. But if you don't have that, as long as the instruments have been sterilized, you need to leave them to cool down a bit. They need to cool down in an area that where asepsis, as much asepsis has been achieved as possible. So it's as clean as possible, as sterile as possible. So when they come out of the autoclave, they cool down, and then you can wrap it with cling film. Now the problem we have with cling film is droplets forming on the inside, okay? So it needs to be cool. The instruments need to have cooled down, and then you wrap them and then you put them away. At the end of the day, what you're trying to do is to make sure that as little contamination gets into them as possible. Now, if you're in an environment where those instruments are being utilized frequently, then store them in a cupboard with a door so they're closed, or get a plastic container, a big enough plastic container where you can put them in with a cover, because the aim is to make sure that infection and dust and debris doesn't touch them before you use them again. Okay, so that's what I said. So as long as they've been sterilized, okay, so they've been washed, they've been disinfected, they've been sterilized, and you cover them and make sure that they don't get infected. Then the gentleman with the comments on the presentation, I do take
Madam Zanetta, sorry, that comment has been overruled, so you don't touch on it. That question or comment has been overruled, so don't touch on it. Thank you. Okay. You can take other concern, but that concern has been overruled.
Okay.
Thank you. Okay. Yes. Any other person with concern? We are almost done. If you have concern, yes, Mr. Alfred, your hand was up some time ago. Mr. Alfred, kindly unmute. We're all Alfred.
So I think I'm okay on it.
You're okay on it?
I think I'm okay.
Yes, okay.
Yes.
That's very good. So let me give the platform now to our president. Once he's around, always he has to have his own bite on the issue. So, Mr. President, you can't be hiding at your small corner with that S calling you. So,
All right. Thank you so much, and good evening to everyone.
Good evening.
Yes, sorry I joined the lectures quite very late because I think I was on some trips and got in I think at that time you had gone quite very far, but I've gotten a little out of whatever went on, and I can get the impulse of it. And I can understand that we are touching the core of the issues, especially given the fact that we are not in normal times. I want to add quickly that all of us will have to take our safety precautions quite very seriously. So that at the moment we are aware that we have at least some members infected. We are very much aware of that, and I'm asking that we say a prayer for them anytime we go to bed. Even when we wake up in the morning, we pray with them and hoping and praying that all of them recover and recover very well. Now, the rest of us, we need to take safety precautions quite very seriously. And I'm adding also that if we by chance get infected, please let us know so that we can help channel that to the appropriate corteses and see how we can all be assisted to get whatever benefits that may be due us. I want to appreciate Madam Zenata for the time she's taken to give us the lecture. Since yesterday, she's been with us, giving us very wonderful lectures. I remember yesterday, a lot of us had concerns, especially when it comes to the gifts. And I believe that now we will understand what to do in the surgery if somebody is kind to us. If in the past we would take and just put in our pockets and go, now we have repented. We will take it. We all can benefit from there. Okay. The association is so much concerned about every one of us. Yesterday, I said that because we are not in normal times, we are deciding that we wouldn't burden members. And so for the CPDs, we're going to have it free of charge for members in good standing. This is not all. August 21st, and I think, let me be very sure of the dates, August 21st and 22nd, we will have another free CPD program for members. Now, the emphasis is going to be around patients with special need. I'm sure that we come across them, at one point in time during our practice or the other, and they need very special attention. Now, we were able to get in touch with someone abroad who is into practice dealing with just patients with special need. And then we spoke to that person, and the person is very willing to be with us on the 21st of August to guide us on what we can do to give them attention. And in fact, they are a people that should be of much concern to us. We realize that sometimes because of their situation, they are unable to maintain very good oral hygiene. How do we help them? When they come, they look sometimes, not very cooperative. How are we going to help them to calm them down so that we can get them through the procedures without any, sometimes the fear, the agitation, they come and see the environment, they are just scared, they will not cooperate. We need to be able to understand that so that as we are working in the practices, when we meet all these people, we'll be able to give them the best of care. There are some of us who even fear them. When we see them, we are scared. You see, so at least we are thinking that at the end of this particular PD session also, will be properly equipped to be able to handle these people. And as part of our